CT scan reveals bony, well-circumcised mass within left mastoid air cell, which is the most likely diagnosis. Okay. 50-year-old man presents with complaints of gradual hearing loss in his left ear over the past year, denies any pain, tinnitus, vertigo, and physical examination. Tympanic membrane is normal, and the external auditory canal appears clear. So he has bony, well-circumcised mass in the left mastoid air cells. Bony, well-circumscribed mass. We talked about this stuff a little bit the other day. Bony, well-circumcised osteoma. Otitis media is just, it's not that. He has a clear tympanic membrane. Acoustic neuroma. I don't see anything like that's suggesting somoma body here. That I can see. I would maybe just think, I mean, mastoiditis. I don't know if that's a bony, well circumscribed mass, though. That's the thing, mastoiditis. I guess like in the mastoid bone part, I'm not too sure.
What's your gut say?
My gut says mastoiditis, but I don't know. I couldn't define that for you besides just being the word.
Okay.
And it's just like, okay, this well circumscribed mass in the left mastoid air cell. I'm not exactly even sure what that is. But none of the other ones seem, unless like osteoma because it's bony, but that's it. I would just go mastoiditis, but I'm not sure. We might have to talk about what this is.
Yeah, so let's talk about this. Okay. So acoustic neuroma is it's actually a misnomer. It's most likely a vestibular schwannoma. They're two names of the same thing, but
Cranial nerve 8, right? And the
yeah,
somoma
it's cranial nerve.
bodies.
Yep, it's cranial nerve 8, but in particular the vestibular side of cranial nerve 8. That's why it's a misnomer because it's not really off, the acoustic side of 8, if that makes
Okay.
sense, right?
Okay.
But anyways, yeah, so not this, right? You're gonna have sensory hearing loss, you're gonna have some vertigo, right? Balance issues, so unlikely that. Cholesteatoma, that's going to be also a misnomer in ENT. I guess we have a lot of misnomers in our field, but it's not actually a tumor of cholesterol, it's actually of keratin debris that
Okay.
causes erosion locally and causes a lot of usually chronic drainage of the ear or chronic otorrhea. So that doesn't fit here, right?
Okay.
Mastoiditis. So there's acute and chronic mastoiditis. We won't get in too much into it because they usually only test you in acute mastoiditis. So we'll just talk
Okay.
about that. Acute mastoiditis is things you look for is a lot of times they're going to be very, very sick, fever, right? Ear is going to be proptotic, meaning the ear is going to bulge forward a little bit. The mastoid bone is going to be super tender, red, inflamed, and there's going to be pus within the mastoid. So this is not really kind of what you see here. Osteoma, the reason why you know it's an osteoma here is they tell you on a CT scan that it has a bony, well circumscribed mass, meaning that
Okay.
it's a bony mass, right? An osteoma can happen anywhere, right, where there's bone, right? It's just a benign tumor of bone. And then otitis media, you have to have fluid within the middle ear, right? If you have acute otitis media, then
It's like ear infection, right? I should
yep,
think
an
of.
ear infection,
Okay.
exactly. So yeah, so best answer here is going to definitely be D.
That mastoid bone is the one that sticks, like it sticks out, right? Like a tail a little bit. Am I thinking of
Yeah,
that?
yeah, behind your ear. It's right behind your
Okay.
ear. Kind of
Okay.
that bone that you feel is kind of where your sternocleidomastoid bone or SCM muscle attaches to. That's one of the
Oh, okay.
attachment. Yeah, so
Okay.
if you follow your SCM all the way up, that's kind of where the attachment is there. So,
Okay.
and then inside that bone, right, you'll have small little air cells within the mastoid cavity. So that's just kind of part of the anatomy there.
Okay.